Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment. Let's talk really about the current state of this industry, of the home health, the hospice, the home care, non-medical industry, right? And, we are starting to see a lot of different changes going on. There's so much, whether laws are being created or it's just making it harder for us to get more patients, more clients. So, what are the different things that we really are facing right now? So agencies, like yours, like mine, just to let you guys know, I truly apologize. It is kind of hot, so I'm going to have my coffee. I'm going to wipe it down a little bit. Okay, there you go. So, all right. Agencies are having a lot of competition, right? In your area, how much competition do you have? How many people or how many other agencies are you competing against in your particular area? So competition is really going up, so we're seeing that more often, whether a hospital has their own agency or another home health agency also does non-medical home care, or you have some agencies that has hospice, home health, and home care at the very same time. There's a lot of competitions going on, right? And then more agencies as we go are now more of them are opening up as we see. That's what's going on in this industry. More of them are opening up. Why? Because people who's working for another agency, sees an agency, the owner's doing well, and they're like, I want to do that too. So they start opening up their own agencies. Now, there are some states that had what they call moratoriums, which was preventing a lot of agencies to open up. And those are being released nowadays, right? A lot of the states are saying, okay, fine, we're opening up the moratorium. There's no more moratorium. You can now start applying for new licenses. And then what we're also seeing is because of the competition going on, is that a lot of agencies are also closing down. And the reason why agencies are closing down is because they mismanaged their company. Like they forgot or miscalculated the fact that they need to market, they need to sell their services. And so we have agencies opening up and we also have agencies closing down. And we're seeing that everywhere, whatever state you're in, whether you're in Illinois, whether you're in Florida, whether you're in California, Hawaii or Puerto Rico, wherever you are, you're going to be seeing this going on right now, right? Just like any businesses or any, area we're in, whether restaurants, whether hotels, we do see them close down. And that's because we forget the part that for us to succeed is we need to bring in referrals, bring in patients, increase our census, and also keep our current people happy to stay with the company to be able to keep on referring to us. And these are going on. And one of the reasons why a lot of agencies are having problems, number one is they don't have marketers. So you have smaller mom and pop agencies that are saying that, well, I'm going to be marketing my company. I'm the owner, I'm the administrator, I'm the DON, and I'm also going to be the marketer. Well, guess what, guys? If you have multiple job titles, how can you actually give it all into marketing? And marketing is not a part-time gig. Now, if you're satisfied with those, 10 patients, that's all that you want, or 10 client census, well then okay, fine. You can do part-time if you want to. But how much or how long can you sustain your company? Right? So, you can't just all of a sudden say marketing is only a part-time thing. If you can't do it full-time, then you need to find somebody to bring in your company. It's like me saying, for example, where I hear a lot of owners who are owners of agencies who are also their director of nursing. What if you only give part-time of your director of nursing, right? What if you only, instead of working 100%, all those 40 hours a week or 50 hours a week for being a director of nursing, and then you say, I'm just going to work 10 hours. What's that going to do to your company? What's going to happen to the quality of care for your patients? It's going to diminish. It's the same exact thing when it comes to marketing. If you're only giving 10 hours a week, 1 day a week, 3 days a month, whatever it is, you cannot expect a success in your agency. Now, if you're happy where you are, then perfectly fine. Maybe this video training is not for you. If you're just happy having a 10-patient agency or a 20-patient agency. But at the same time, it goes the other way. If you want more, then I'm glad that you're here. And I want you to continue on. And I want you guys to be able to have success. That is the main goal here, is figure out the mindset. Do you want to grow or do you not want to grow? Because all I can say, like I said, if you hit the plateau, if you hit the flat line, and you don't see any progression, the only direction your company will go is below and go down. So you need to understand this is what you need to do. Now, I truly understand that a lot of companies or a lot of owners will say something like, Michael, the reason why we don't hire marketers is because they don't work. That, they just don't do what they're supposed to be doing, or they're not producing, right? They're not producing. Well, I always ask this question, like, well, then who is there to blame? Is it the bad marketer, or is it the person that hired the marketer, right? Did you screen them properly? Did you do their background? Or did you just believe in them when they said, you know what, I can bring in 20 referrals a month and you should hire me? The truth is this, some of the best marketers out there, they have jobs. They have jobs because companies who recognize great marketers, they're going to do everything to keep them in their company, right? So a lot of people don't want to hire because, they say that the marketers that they have just don't produce. Well, I always say this, is that when you bring in a new employee, the best thing to do is provide them education and training, right? When you bring in a nurse, for example, to work for your home health or your hospice agency, guess what? You provide them an orientation. You show them the policies and procedures. You tell them what's expected. Then you have somebody shadow them in the field to make sure that they know what they're doing, to return on demonstration. Yet when you hire marketers, when they say that, oh, they're experienced, you just say, okay, well, fine, here's the brochures, here's the folders, go out there and market our company and bring us our clients. Or what I really love to see that makes me kind of chuckle at times is that when agencies are hiring a marketer, they'll put in advertising, and an advertising say must have a list of clients or must have a book of clients ready to go. And that's my thing. Yeah, they may have contacts. Heck, I have lots of contacts. But that does not mean that all of a sudden, just because I move to another agency, that does not mean that those facilities, those referral sources are now going to transfer with that marketer. So that is the thing. Do they actually have the connections? But the main thing is if you can actually provide education and then also making sure that you know how to manage your team, how to be able to practice, drill, and rehearse with them, to be able to pay attention to what they're doing and have a clear strategy with them. Now that right there is the most important thing. The larger agencies out there are winning because, you know what? They actually have somebody that's really taking over and watching your team. And because they have a large referral source base already. So they have to have managers managing the teams. It's the same thing for you guys. If you're starting off slow, you can still manage your marketing team. But eventually, do you want to grow really? And that's where you need to pay attention on how to first manage them and also how to educate your marketers and how to be able to provide them with every material, everything that they need, all the tools, all the bells and whistles to be able to show the difference of your company and to make your company stand out. When we talk about competition, like we said earlier, like for example, in Los Angeles, home health, medical home health agencies, there's over 845 of them. So if you're in the LA County area competing for patients within that area, you're competing against 845 agencies. If you're competing for non-medical home care, you're competing against 1,800 non-medical home care companies. That's a lot, but that does not mean that you can't get business. Just imagine if you can take one patient from each one of those 845 agencies a month. What is that going to make you? It's going to make you into an 845 census agency. So you guys have to understand that they do have patients. It's distributed among all the other competitions in your area. And at one point, I want you guys to pay attention to that. At one point, every agency that ever opened up started with zero. Just like you. So the question is, what are you guys willing to do to take it from zero to whatever number you decide that you guys want it to be? To have that goal. But always understand that when you hit that goal that you want, you have to keep on increasing that goal. That's the mindset that you guys need to put. If you're competing against the Chicago area and the Cook County area, you're competing against 551 home health agencies and 657 home care companies. If you're in Miami, Florida, you're competing against 636 home health, and you're competing against 600 home care. Philadelphia area, 345 home health agencies, and you're dealing with 1,500 something home care companies. That's a lot of competition. But the main thing is to learn how to be able to make your company stand out. And other than the fact of making your company stand out, how do you make your marketers stand out? Because that's right there, is creating that relationship. And that's what we're going to be doing in this whole training, is to show you guys. It's really crazy when we start looking at numbers. And these are, really good data that we can actually acquire. And this is for, just to let you guys know, this is for home health medical. You know, we started seeing in certain areas, in certain pockets, the averages, you know, the 83% of bottom agencies, meaning the agencies that are in the bottom of the list. If we, let's say, for example, out of 100, we'll say something like that, 83% of the bottom agencies are sharing only 25% of the available patients out there. These are for Medicare patients, whereas 17% of the top agencies are in control and sharing 75% of the patient market. So just imagine that. Just seriously imagine that.